hello, my name is Joseph Grantham. I'm going to be your nurse today. I've heard that you've been having some problems with your shoulder, correct?
Yeah, I injured my shoulder skateboarding the other day, and now it hurts to move.
Alright, I want to ask you some questions about that in a little bit, but first, Can you give me your name and date of birth?
Rachel Stewart, 070297.
Okay, Rachel Stewart. I need to take some notes here while I'm going along. Is that alright?
Yeah.
So Rachel Stewart, R.S.
Oh, S-T-E-W-A-R-T.
Okay. And you were born?
070297.
Ah, thank you, ma'am. So it appears that you are communicating effectively and you're appropriately dressed. I don't see any winter coats laying around here.
No.
Oh, wonderful. So you're alert and oriented ×4. Now, before I go any further, I would like to take some of your vital signs. Is that okay?
Mm-hmm.
Ah, wonderful. First, we're going to start with your temperature. This is an oral probe. Have you had anything to eat or drink in the last 15 minutes?
No.
Have you smoked anything in the last 2?
No.
Wonderful. Would you care to do this? And that's beep, great. 98.6 degrees Fahrenheit. Wonderful. Next, I'm going to check your pulse. Would you prefer left or right arm?
It doesn't matter.
Okay. Okay. Your pulse is 106 beats per minute.
Is it really?
It sure is. If you'd like, I can double check.
No, that's fine.
And that was on your right radial. It was a nice strong pulse, and it was regular, so 2+ regular. And you were also, I noted you had 16 breaths in a minute. So next I'm going to use this device called a pulse oximeter. I'm going to attach this to one of your fingers. Okay, and beep. 99% oxygen saturation on room air. Alright, last thing for the vitals is me checking your blood pressure. So I'm going to need you to scoot out towards the edge of this bed here. You need to keep your legs uncrossed. So the first thing I'm going to do is hook you up to this blood pressure cuff, but first we need to make sure it fits.
It's going to be a little too big, but that's okay.
We're not going to worry about that. Okay. Fits with the length 80% around, plus or minus 10%, over 20 or 30, and the width is 40% around, plus or minus 10%. that should do just fine. If this is just too tight, you let me know, okay? Is that all right?
Mm-hmm.
Ah, wonderful. Now, could you help me out here by holding this up towards me? So, before I whip out the stethoscope, the first thing I'm going to be doing, you know what, let's prop your arm up here. Make that a little bit more comfortable. Is that okay?
Mm-hmm.
So I'm going to take your palpable systolic to make sure that I don't miss the oscillatory gap. Right. Palpable systolic is 102. So we're going to give your arm a break just a second there while I document this. Oh, there goes the pulse oximeter, and I'll find that later. Let me clean off my stethoscope here real quick. So I'm going to be placing this right over your brachial pulse. And I'm going to inflate the cuff, and I'm going to be listening for the systolic and diastolic blood pressures. Could I have you turn that towards me? Okay. Your blood pressure is 106/70. Do you think that lines up with your baseline?
Yeah.
Thanks for your help there. Now I have a few questions about your shoulder. Well, we need to get bigger tables here. We have too much equipment for these tiny tables.
Underfunded hospital.
Oh, tell me about it. So that blood pressure, I said, was 106/70. 72? Ooh, thank you, thank you. You have a better memory than I do. And that was on your right arm, sitting, legs uncrossed. Now, can you describe the character of this pain that you're experiencing? What does this feel like?
It's kind of like a throbbing pain. It's not really, it's pretty localized, but my whole arm feels a little bit sore and funky.
So it's a throbbing pain, and the arm feels swollen and funky?
My arm kind of feels just like numb towards my fingers. But yeah, the pain's mostly in the shoulder. And it feels okay like whenever I'm resting, but if I try to move it or if I try to lift anything, it's just not happening. It's really stiff.
Alright, that's a lot to work with there. When did this pain begin?
I fell last night.
Really now?
Yeah.
What time last night?
Around 8 p.m. I was riding around on my skateboard with my sister and I hit a curb.
Hit a curb and you bailed?
Mm-hmm.
Oh man, one time I hit a curb while riding on a skateboard and I did a front flip into a cactus.
Oh no.
Yeah, that was not fun pulling out all those little needles out of me. But I think it turned out pretty alright. And I'm sure you'll be fine too. So you say that this, for the most part, most of the pain is localized to your shoulder?
Yeah.
That is your right shoulder. And you mentioned numbness and tingling going down towards your fingers?
Mm-hmm. If I try to pick something up, the pain gets kind of sharp, but other than that, it's just throbbing. Mm-hmm.
So whenever you pick things up, the pain, it flares up?
Yeah.
Does the pain, is it always there, or is it only really when you pick things up?
It's always there a little bit, but it's manageable if I'm resting.
So this is a two-part question here. Is it recording?
Yeah, I'm making sure it was.
So, whenever the pain is just kind of there, but you're resting and it's manageable, on a scale of 0 being no pain at all and 10 being the worst pain in your life, what number would you put on the resting pain?
Like a 4.
Okay. And what about whenever you try to, say, pick something up and it flares up? What would that number get up to?
About an 8 out of 10.
Oh my goodness. That's really intense.
Yeah.
Seems like you're rather composed, though.
Yeah, I've had other injuries before.
Oh, really now?
Mm-hmm.
You seem to be doing fairly well for yourself. So resting makes the pain, like, dissipate a bit. It's not as bad.
It's kind of hard to get comfortable, but it definitely feels a lot better laying down.
So there's a pattern to resting, makes it feel better. Whenever you try to lift something up, it makes it feel way worse.
Yeah. And also icing it helped a lot, too.
Oh, ice. Very good. Is there any other pattern associated with this pain? Have you noticed any other problems with yourself?
No, just that. I mean, sometimes the pain will radiate, like, up to my neck a little bit.
Okay.
But I also hit my neck a little bit whenever I fell, so that might be it.
Goodness.
But
so
not
there's
as bad.
no other systemic problems going on? Okay. So would you say that this pain in your shoulder has limited what you can do in a day?
Yeah, since it's my dominant arm, I can't really write, and it's hard to even use my phone.
So that limits you pretty severely.
Yeah. I mean, like, I can get up and walk around and move around, but it hurts when I do that, too.
Okay. Alright. That was some really good information there. We'll certainly make sure to pass that along to your primary care provider. But for right now, I'd like to do a full body assessment. So that's going to be going head to toe. Is that all right?
Yeah.
Wonderful. So we're going to begin with your head and face. Oh man, nursing assistant gave me the small gloves again.
Can you get them on?
I think they'll work. They didn't pop or anything. Just a little bit difficult to get on.
You know, every other nurse in this robot hospital has really small hands.
I've come to learn. Soon enough, I'm just going to have to bring my own box and carry them with me. But with the stinking disease going around, there seems to be a lack of PPE everywhere.
Mm-hmm.
So we're just having to make do for the time being. At least I can move my hands. Alright, so the first thing I'm going to be doing is checking out the general shape of your head, okay? Okay. That head is a normal cephalic shape. No signs of bumps or lesions. Skin is intact all the way around. Ooh, you sure do got a lot of hair there.
Yeah.
There isn't anything hiding under there, is there?
No, nothing I've noticed.
Oh, wonderful. So the hair, it's clean, fine, a bit wavy, dark hair. It's evenly dispersed. Your face is symmetrical. Features are proportionate. Skin is dry, intact. Very good. No signs of erythema, rash, lesions. Skin color is fair. Now, I'm going to have you do something silly for me, okay?
Okay.
First, I'm going to have you smile. Oh, very nice. And frown. Show your teeth. Blow your cheeks out. Raise your eyebrows. And tightly close your eyes. Oh, very good. So you did all of that with no problem. Your cranial nerve 7 is intact. Now we're going to do another little test with this cotton ball here. So I'm going to have you close your eyes, and I'm going to touch you with this. Whenever I touch, say yes that you felt it, okay?
Okay.
And close your eyes.
Yes. 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 Yes.
Ah, very good. So, with you responding to all of those yeses, cranial nerve 5 is intact. Now I'm going to palpate your temporal arteries. Now just let me know if you feel any pain or tenderness. Can you pull your hair back just a little bit?
Would it be easier if I put it up in a ponytail?
That would be very helpful, yes. Thank you. Left temporal artery, 2+, regular. No pain, no tenderness.
No.
Right temporal artery, 2+, regular. Very good. So now I'm going to have you move your jaw around. Can you wiggle your jaw for me? Okay, so I'm going to be pressing your temporomandibular TMJ, that word. Can you open your mouth for me? Now, can you move your jaw side to side? Okay, that doesn't hurt at all?
No.
Wonderful. So there is full range of motion, no signs of crepitus. You said there's no tenderness, no pain. So now I'm going to be checking out your eyelids. Can you close your eyes for me? Open them. Look around just a little bit. Okay, very nice. Eyelids symmetrical bilaterally, evenly distributed eyelashes with white sclera, no signs of conjunctivitis, skin is fair, no signs of discoloration. So now I'm going to be using this pen light here to check your pupils out, okay? So look straight at me. Oh, did my battery die? Okay. Okay. Very nice. Now, focus on the tip of this. Oh. So your perla is intact, and that is your pupils are equal and round, and they react to light and accommodation. So now I'm going to use a cotton ball. I'm going to lightly touch your eyelashes, and I'm going to see how your eyes respond, okay? Alright, that was the proper reaction. You blinked immediately. So that means your cranial nerve 7 is intact. Okay. You need to check out your ears now. I'm going to move your hair back, okay? Look straight ahead at me. Okay. Your ears are symmetrical in size and shape. Skin is intact and dry. Oh man, we really need to figure out a way to make these beds higher. I'm too tall for this.
It's not a good working height.
Not a proper working height. Stuff like this is going to ruin my career. It's going to break my back, I'm telling you.
I don't even think these beds lock.
My goodness gracious, where are the brakes on these beds? So there's no signs of lesions. Skin color is fair, no discoloration, no signs of inflammation or drainage. So now I'm going to be pressing your mastoid process, which is just behind your ear. Can you open your jaw for me? So no tenderness, no pain.
No.
Wonderful. So now I'm going to test your hearing, okay? So I'm going to need you to turn this way as best as you can. I'm going to have to be on either side of you, and I'm going to be whispering a certain phrase, okay?
Okay.
Now, I mentioned before, not very good at whispering, but for your sake, I'm going to have to do my best. Tell me what I say. Baseball.
Baseball.
Very good.
Hot dog.
Oh man, hot dogs at a baseball game, that sounds like a good day right there. Alright, whisper test passed, your hearing is intact. Now I'm going to be checking out your nose, okay? Did you ever break your nose as a kid?
No.
Okay. It has a slight bend to the left. So
Does it really? I've never noticed that.
Just the tiniest little bit.
Honestly, I probably could have gotten hit in the head.
Oh man, yeah, I broke one of my friend's noses once, and like I had to like put it back into place for him. So thankfully it healed up to where it looks just fine, except it has just the tiniest little bit of a crook in it, and only me and him know it. So it's not quite symmetrical, but it's very proportionate and midline. Skin shows no sign of lesions. No inflammation, no drainage, don't have anything falling out of your nose.
Yeah.
Okay, so now I'm going to be using this light and I'm going to be looking up into your nose, okay? Can you tilt your head up for me? And this light might get into your eyes, okay? Okay. No obstructions, no occlusions. Tell me if this hurts at all, okay? No pain, no tenderness?
No.
So now I need to check the patency of your airways, like how well air goes through your nose. So can I have you press one nostril closed? Try to breathe really hard for me. Ooh, you sound a little bit stuffy. Do you have allergies?
Yeah, I have a little bit of allergies.
Okay, that's fine. Yeah, it definitely sounds like there's just a little bit of something in there, but it doesn't seem like it's causing you any trouble, is it?
No.
Okay. So I don't see any mucus up there. The mucosa is pink. No inflammation. No problems.
Of course.
So now we are going to be checking out your mouth and throat. Is that okay? Mm-hmm. Wonderful. Now, where did that tongue depressor go?
I don't think we had one.
Don't think we have a tongue depressor. Okay. Would you... Hi, Dr. Rivera, for the sake of this video, Miss Rachel here is gonna just try her best. So we don't...
I'll put in a really good effort.
Alright, like, use your tongue as a depressor as best as you can.
Just like...
So I need to look all around. So the first thing is your lips. Pink. Lips are smooth, no signs of lesions. Alright, next, smile really big for me. Let me see those teeth. Okay, top teeth. Let me see your bottom teeth. Kind of look like a caveman. All teeth are present, no signs of plaque or excessive buildup. Now I need to check out your gums.
You need to, like, do what you gotta do.
Do what I gotta do? Okay. Doesn't hurt at all?
No.
Okay. Thank you for working with me there. Gums and mucosa are pink, moist, intact, no signs of lesions. Now I need to check out your hard and soft palate. So open up real wide for me. Very nice. Hard and soft palates are pink, moist, intact, and there are no signs of lesions, and crashing is killing me. Oh my goodness, I'm too tall for that. Oh, I need new scrub pants. These are not the best.
You can try to put on mine.
Oh, you know, I don't quite think your scrubs will be in part of my uniform. As nice as that is, unless they're like this color maroon.
No, they're bright blue.
Bright blue. Not quite gonna cut it for today. I'm sorry. Okay, so hard and soft palates, pink, moist, intact, no signs of lesions. Alright, this is the fun part. So we're gonna be like holding your tongue down because I need to look at the very back of your throat, your uvula, okay? Say ah.
Ah.
Oh, that's everyone's favorites. Very nice. Alright. Uvula intact, rises midline. We also need to check out your tonsils as well. Just on either side of the uvula. Tongue depressor. Okay. Tonsils are 1+, normal. There's no obstruction of the airway. Now I need to palpate your tongue. Thank you. Thanks for working with me here. Okay. Tongue is red, firm, moist, no cracks, no lesions. And I need to get rid of these gloves.
There's more gloves on the table behind you.
Oh, thank you. I think I might need those in a little bit. Alright, so next we're going to be moving on to your neck, okay? Wonderful. Alright, can you look straight ahead for me? Can you bend your head down? Just for the sake thereof, you know?
Preventing those hospital-acquired infections.
Oh, absolutely. 100%. No can do in this business. It is malpractice waiting to happen. Alright. Can you bend your head down? Okay. Skin dry, intact, no arrhythmia, no discoloration, no signs of lesions. Neck appears straight with no inflammation. I'm going to test the range of motion for your neck. I'm going to have you look in different directions and I want you to move your head, okay? Ready?
Mm-hmm.
Look up. Look down. Look left. Look right. Now I want you to touch your ear down to your shoulder without moving your shoulders. As best as you can. Okay? Very nice. So you have full range of motion that didn't hurt at all?
It hurt a little bit in this side.
Okay, that's reasonable. You're able to be a trooper going through that. So now I need to palpate all of your lymph nodes. So we're going to start with the submental. And if all is well, I shouldn't be able to palpate anything. Submandibular. Consular. Preauricle, yep.
Preauricular.
Auricular, yep, there we go. I'm getting there. Occipital. Superficial cervical. And the deep cervicular chain. And right. Okay, perfect. Oh man, they don't have one listed here. How dare they?
Supraclavicular? Or...
Yeah, supraclavicular. That's what I was 100% missing. Supraclavicular. So, I need to check this out one more time. Turn your head to the left. Turn your head to the right. Okay. So I was not able to detect any of the lymph nodes, no signs of inflammation. So next I'm going to be trying to palpate your trachea, okay? Sounds like it might be lunchtime.
Mm-hmm.
I understand. I'm right there with you. Okay, trachea straight, midline. Now I need to auscultate your carotid arteries. First I'm going to palpate them. Okay, 2+, regular. 2+, regular. Now I need to listen to them and see if I can detect any bruits, or brutes, or that's a really funny word.
What is that?
That would be your arteries making some sort of swishing noise when there shouldn't be any at all.
From like turbulence or something?
Something like that. That's a good way to describe it.